Hello viewers, welcome to the Academia. Today I will discuss blood coagulation. So before entering into the topic, I will show some blood coagulating factors which are very important and which present in the plasma. So there are 13 factors which are very much important regarding the cascade of blood coagulation. The blood coagulation was invented by Macfarlane and the cascade theory is very much important. First of all, factor 1. So this factor is also known as fibrinogen and the molecular weight is 3,30,000. And how much plasma level of fibrinogen is present? It is 200 to 450 mg per dl. Okay. Next factor is factor 2, that is prothrombin. The molecular weight is 69,000 and the plasma level 40 mg per dl. So the plasma levels are important, that how much of the factor 2 is present. Factor 3, which is called thromboplastin or tissue factor or tissue extract. Factor 4 is ionic calcium. So one common question is that which factor of coagulation doesn't contain protein? So it is factor 4, which is calcium. Next one, the factor 5, it is known as labile factor or accelerator globulin or proacceleratin. It gets consumed during clotting and therefore absent from serum. So it is not found in the serum. Next, coming to factor 6, then factor 7, which is known as serum prothrombin conversion accelerator, that is SPCA. It is also known as stable factor or autoprothrombin 1. It is not consumed during clotting, therefore it is present in serum as well as in the plasma. Next one, factor 8, very important for MCQ, which is called anti-hemophilic factor, AHF, anti-hemophilic globulin, AHG, or anti-hemophilic factor A. So it is also absent from serum. Next one is factor 9. It is known as Christmas factor, plasma thromboplastin component, PTC, or autoprothrombin 2. So these are the another names of the clotting factors, and for the MCQs it is very much important that which factor is called the Christmas factor. It is factor 9. Factor 10, Stewart-Prower factor, autoprothrombin C, present in plasma and serum. In both plasma and serum, autoprothrombin C is present. Next one is factor 11, which is plasma thromboplastin antecedent, that is PTA or AHFC, and they are also present in both plasma and serum. Factor 12, that is Hugman factor, also known as glass factor, contact factor, and they are also present in both plasma and serum. Next one, that is the last, factor 13, fibrin stabilizing factor, fibrin-Reyes Lucky-Laurent factor. So these are the another names of these factors. So here all the 13 factors are very much important for blood coagulation. And in the blood coagulation, first step is formation of fibrin. Number 2 is formation of thrombin. Number 3 is formation of prothrombin activator. And number 4 is formation of active factor 10. And number 5, clot retraction. So in these points, and another one is number 6, limiting reactions, etc. So in these points we can divide the blood coagulation process as a whole. Hope these factors you can understand. The names are equally important as well as the other names. And then we move to the mechanism, extrinsic and intrinsic mechanism of blood coagulation.